I'm a Southern girl from Texas who had a pretty amazing childhood. Tight-knit family, 3 younger brothers, but it all came to a screeching halt when I was 13 years old and we lost our 42-year-old mother. The ripple effect of her sudden death was devastating. It literally ripped apart our family. And about a decade later, I lost my father. And while cancer and diabetes played a role in their untimely deaths, so did wrinkles in the healthcare system. The issues they faced decades ago continue to torment the healthcare industry today, continue to snatch our loved ones well before their time. Their voices were not heard at the time, and I was too young and too inexperienced to know that I could use my voice to advocate for them. And my sleepless nights of what-ifs fuel my passion to empower patients and their families today. We're at a pivotal time in healthcare with an explosion of health technology, data liberation, ease of access to biometric information, and patient-centric innovations. What's exciting is that these innovations are giving us a glimpse into key facets of healthcare that were once impossible to untangle. Once uncharted territory, these innovations are helping to pave the path forward, but there's a key element that's missing. I often wonder whether the innovations we're creating today would have addressed some of the issues that my parents faced decades ago, would have saved them from missteps along the way. As a patient advocate, I work with patients and their families on a daily basis, and I witness their frustrations that still are not being addressed with the innovations that we're creating that are labeled as patient-centric. The healthcare system has been busy building complex systems, spending billions of dollars creating intricate innovations, developing health mobile apps. I lost count at 100,000. But we've lost sight of the basics. We've lost sight of building simple solutions to address simple problems that patients face daily. Innovation isn't about creating that shiny new car. It's about paving a smoother path for patients to travel down. And it's imperative that we partner with patients to pave that path forward. You would never build a house without the expertise of an architect. So how are we building healthcare without the expertise of patients? The expertise of the patient can't be learned unless you've walked in their shoes. And it's imperative that we co-design the future of healthcare with patients every step of the way. So I'm going to make a wild assumption that majority of you have interfaced with the healthcare system in one way or another. Now, if you could wave a magic wand and change one simple thing about healthcare, aside from making it free, what would you change? Think about that for a minute. Now, to broaden the conversation beyond this room, I reached out to the community to collect their stories and ask that same question. And I received over 1,200 responses. Some were simple, others a bit more complex. For instance, I need a better roadmap. I am lost. Transparency and costs up front, no unexpected surprises. And one of my favorites, give me my damn data in a way that I can understand. Now, I was going to bore you to tears with fancy charts and graphs and show you some of the data that came out of that survey, but instead, I decided to illustrate the point of back to the basics by partnering with patients to collaborate a simple solution to address a simple problem they have. The simple issue was the hospital gown. From the 1900s, minus a snap or two. Many patients felt that it made them feel dehumanized and exposed. So I brought together 35 patients, and we crowdsourced hundreds of comments to talk about what they liked about the gown, which was nothing, what they didn't like, and we also brought in clinicians to talk about what was important to them, like easy access. We then worked with fashion designers to sketch out a few prototypes based upon the feedback compiled, and a seamstress to stitch it. And what we came up with was a hybrid between a kimono wrap top and basketball tearaway pants. And our lovely co-host, Gail, is modeling our prototype. I want you all to notice the easy access down the sides. Yes. I know it's a little too early for that, but no exposing, yes. Thank you so much, Gail. Beautiful. Now don't worry, I'm not going into the hospital gown business, and it is a work in progress. And I used the simple issue of the hospital gown because it's something that each and everyone here can relate to, whether it was you or a loved one in those dreadful gowns. And that's a very simple example of partnering with patients, but the implications and the ripple effect of partnering with patients on a broader scale are tremendous. The voice of the patient is being amplified into a powerful roar as they provide feedback on their healthcare encounters and help redesign the encounters around certain diagnostics like the MRI, for instance. They are unifying their data to accelerate diagnosis and research through networks and crowdsourcing communities. Patients are initiating and driving research. They're influencing clinical trial design in partnership with research centers and pharmaceutical companies. Patients are influencing healthcare policy. They're developing technologies and developing everything from therapeutics to new technologies. There is an evolution underway where we're beginning to understand the value of partnering with patients, and by putting a spotlight on how these collaborations are revolutionizing healthcare, these isolated partnerships will become mainstream rather than patients symbolically at the table. The current state of healthcare, we all know it needs to change, and now is the time for the voices of patients to be amplified into a powerful roar that will ultimately transform healthcare as we know it. So how do we move this from theory and isolated interventions to reality? To amplify the voice of the patient and ensure that their roar is heard, I've created something called the Patient Shark Tank that allows patients to provide perspective on the design, the development, or the enhancement of any innovation designed to serve them, whether it's technology, whether it's a mobile app, whether it's policy, a product, a service, research design, or even a hospital gown. And it's a great way to demonstrate that the voice of the patient is critical in reshaping the future of healthcare. And this is where any innovator, any person, organization can pitch their initiative to a panel of patients that provide perspective based upon their experiences. We've co-designed a scorecard that they use to assess the innovation, and the innovator can either go back to the drawing board or integrate the perspectives into that innovation and charge forward. We have evaluated over 85 innovations to date across academic medical centers, pharmaceutical companies, insurance companies, technology companies, startups. Patient voice, a great way to ensure that the patient voice is heard. So I have guardian angels that have been watching over me since the ripe old age of 13. I've been writing letters to my parents, my guardian angels, throughout milestones like getting into college, getting my first real job, getting married. I've written letters when there are issues that I've wanted to change. Well, today is one of those milestones. I am declaring that the roar of the patient will echo throughout healthcare, changing the healthcare landscape as we know it, and no longer will patients be at the mercy of the healthcare system surrounding them. That drive to change healthcare, to implement change, that's the catalyst we need to turn healthcare upside down. Each and every patient has a unique perspective that's critical in shaping the future of healthcare. You are the architects of your journey. It's no longer just my letters to the Milky Way, it's our letters to the Milky Way, where our voices will unify into a powerful roar that will ultimately transform healthcare. So I've created this event called Letters to the Milky Way, where the community can come and write these messages similar to my milestones. And I'd like to illustrate an example. This worked during rehearsals, so we'll try to make sure it works right now. Thank you. Don't worry, I've come prepared. Fire extinguisher, just in case we need it. So here's my letter to the Milky Way. The roar of the patient is recognized as the #1 accelerator to fixing healthcare. Let's democratize healthcare by partnering with patients to co-design the future of healthcare. Thank you.